When people think about grooming a Chow Chow, they think about coat, the mane, the brushing, the shedding. Very few think about teeth. And yet, oral health is one of the most important and most misunderstood aspects of long-term health in this breed. Today we're going deep into Chow Chow teeth. Do they really need brushing? Are bones enough? Do water additives work? Why does mechanical cleaning matter so much? And what does anesthesia have to do with prevention? This is not generic dog dental advice. This is Chow-specific stewardship. Plaque is not simply food stuck on teeth. It is a biofilm, a structured colony of bacteria that attaches to the tooth surface. If it is not disrupted, it mineralizes. It hardens into tartar, and once tartar forms, it cannot be brushed away. It requires professional scaling under anesthesia. That distinction is critical. Plaque can be disrupted at home. Tartar cannot. Prevention always happens at the plaque stage. Here is where nuance matters. For many Chow Chows, daily brushing is not automatically necessary if consistent and appropriate mechanical chewing is provided. Structured, fairly hard, natural chews can create effective mechanical abrasion. In properly managed raw feeding systems, correctly selected bones can also maintain clean teeth. But this depends entirely on the individual dog. Chows generally do not gulp large, hard items whole the way some breeds do. They tend to work at them methodically. However, supervision is mandatory. Correct sizing is mandatory. Matching hardness to your dog is mandatory. The principle is simple. Mechanical plaque disruption must happen somehow. If it happens through chewing, brushing may not be essential. If it does not, brushing becomes necessary. Chewing is not just dental maintenance. It is regulating. It lowers arousal. It satisfies instinct. It provides calm engagement. For an independent breed like the Chow Chow, this matters. But Chows are not typically enthusiastic about chewing hard artificial toys without purpose. If there is no taste value, no biological reward, most Chows see little point. This is why many commercial dental toys fail with this breed. Taste motivates. Function motivates. Novelty alone does not. If structured chewing is not part of your management, or plaque is already building, or your dog cannot tolerate hard chews, then brushing becomes essential. And with Chows, the approach matters. Force creates resistance. Conditioning creates acceptance. With puppies, start early. Lift lips gently, touch gums, run fingers over teeth. Briefly open the mouth. Keep it short. Keep it calm. Make it normal. Chows accept what is normal. They resist what is imposed. With adults, begin with lip lifting only. Then brief mouth opening. Then gently placing fingers under the lips, lightly touching the teeth. Do this outside of dental time. Make it neutral. Only once calm acceptance exists should you introduce a toothbrush. Brush small sections. Do not attempt the entire mouth at once. Keep sessions short. End calmly. Chows remember negative physical experiences. Never create a battle around the mouth. End calmly. If you are brushing, use only dog-specific toothpaste. Never use human toothpaste. Human formulations contain fluoride and foaming agents designed to be spat out. Dogs swallow toothpaste. So products must be formulated for canine safety. Now here is something important. The brushing action, the mechanical movement, is what disrupts plaque. Toothpaste supports. Many canine toothpastes are enzymatic. They may help reduce bacterial load. They may improve breath. They may slow plaque formation. But without physical brushing motion, toothpaste alone does very little. Mechanical action comes first. Toothpaste is supportive, not primary. There is another category owners often ask about. Liquids added to drinking water. Gels or fluids applied directly to teeth. These do not provide mechanical abrasion. They work chemically. They may reduce bacterial load, alter oral pH, disrupt early biofilm formation, slow plaque mineralization, improve breath. They can be useful as adjuncts, but they do not remove plaque, and they do not remove tartar. If tartar is present, these products will not reverse it. They are best used alongside chewing or brushing, between professional cleanings, or when brushing is limited but you still want daily support. Another practical note: some chows may refuse water that smells or tastes altered. Hydration always takes priority. If water intake drops, discontinue immediately. These are tools, not shortcuts. Professional dental scaling requires general anesthesia. True scaling includes cleaning above and below the gum line, periodontal probing, often dental radiographs. It cannot be done properly on a conscious dog. If tartar accumulates significantly, anesthesia becomes necessary. And here is why prevention matters in this breed. It is recognized that some Chow Chows may show increased sensitivity to certain anesthetic agents. This does not mean anesthesia is unsafe. It does not mean avoid necessary procedures, but it does mean unnecessary repeat exposures are not ideal. Consistent mechanical plaque disruption at home may reduce the frequency of dental procedures, lifetime anesthetic exposure, cumulative physiological stress. If your chow needs a dental under anesthesia, do it. Untreated dental disease is more dangerous than properly managed anesthesia. But ideally, we prevent before we treat. Chow Chows often have heavily pigmented mouths. Gums may be blue-black or deep purple. The tongue is typically dark. The inner lips and palate may also be dark. But not every chow mouth is uniformly pigmented. Some individuals have mixed pigmentation. Some retain pink gum areas. So instead of memorizing what should be there, familiarize yourself with your own dog's baseline. When your dog is healthy, examine carefully. Learn where pigment normally sits, where natural pink tissue exists, the symmetry of the gums, the appearance of structures under the tongue. In many dark-mouthed chows, the most visibly pink areas are the salivary gland openings beneath the tongue. But variation exists. The key principle is this: anything new, anything enlarging, anything ulcerated, anything changing color, note it. Depigmented spots that were not previously present should be monitored. Raised areas should be examined. Chow Chows are predisposed to oral tumors. Early detection depends on familiarity. You cannot identify abnormal unless you know what is normal for your individual dog. Make inspection monthly, not rushed, not reactive, deliberate. If you notice a chipped tooth, a fracture, uneven wear, a darkened tooth, consult your veterinarian. Some chips can be smoothed, some require treatment, some require extraction. Chows are stoic. Eating normally does not mean absence of pain. A Chow Chow may live 12 to 15 years. Chronic low-grade dental disease over that span affects systemic health. Oral bacteria enter the bloodstream. They influence inflammation. They impact organs over time. Healthy teeth are not cosmetic. They are systemic protection. When we speak about preserving the integrity of this ancient breed, dental management is part of that responsibility. Mechanical plaque disruption is non-negotiable. It can come from structured chewing, brushing, or a combination. Dental fluids can support, but they do not replace. Inspect regularly, act early. Partner with a veterinarian who understands the breed. Grooming is not vanity, it is stewardship. And dental care is one of the most powerful forms of prevention you control at home.